Well, we're going to talk about 5 things that everyone should know about fetal alcohol spectrum disorders. Number 1, alcohol affects a developing fetus at the most minute levels. There really is no safe amount of alcohol. 1 glass of wine dissolves approximately 10,000 cells in a developing fetus's brain. That's a really big deal, because when you lose a cell, when your brain is just forming, just building, then you lose the trillions of neural networks of cells that were supposed to develop out of that cell. So a brain that's been prenatally exposed to alcohol is actually built differently, and that difference is permanent. It's permanent brain damage from like 8 days of pregnancy to the very end of pregnancy. Once the fetus, the blastocyst, is implanted in the uterus, and there's a direct connection between the mother's body and the fetus's body, everything the mother takes in goes directly to the fetus. So the brain gets a hit every time a woman has a drink of alcohol during pregnancy. Okay, number 2. This is not just a problem in the Alaska Native population. It's not just a problem in Alaska, it's a problem anywhere people drink, which is all throughout North America. According to the Center for Disease Control, a very high-risk group to give birth to children with fetal alcohol are Caucasian women who are single, who are college-educated, and who live in households earning more than $50,000 a year. Okay, the third thing we need to know is, although prenatal exposure to alcohol is the leading cause of mental retardation, or what we now call cognitive impairments in the Western world, most children born with prenatal exposure to alcohol have an average IQ. They're not able to function on that level because of the brain damage caused by fetal alcohol. Kids with fetal alcohol have a problem-solving age because of how their brain is built differently. They're able to problem-solve social problems on a daily basis at an age, developmental age, half or less than half their chronological age. It means that a child with fetal alcohol, even with good parenting, good nutrition, and great teachers, is not going to be ready to go out on his own at 18. They're going to be cognitively mature at 25, 26 instead. The fourth thing that I want people to know is that we know what to do. We know how to help children with FASD achieve success in adult life, have better outcomes, and it starts with a diagnosis. A diagnosis of an FASD is vitally important and a predictor of success in adult life. Some of the things that they have are poor memory problems, short-term memory, inconsistent performance, superficial understanding, and naivete. That's what a child with fetal alcohol is dealing with. All those things can look like oppositional behavior, the poor choices, or even poor parenting. It's not those things. It's how the brain works differently. And if we attempt to just deal with the secondary disabilities, then we can cause more problems. What I want to tell people, parents raising children with fetal alcohol, is if they go to a therapist or a specialist or a psychiatric facility and they say, you know, my child was prenatally exposed to alcohol, I wonder if they have FASD, and the therapist says, well, they may have FASD, but what we want to work with is their behavior, go to a different therapist because they don't understand the disability. I want Alaskans to know that we're all affected by fetal alcohol spectrum disorders. It affects society on such a big level. It's the elephant in the living room, the whale in our umiak. That's the thing we're not talking about. We cannot deal with bullying and violence in schools. We can't deal with the recidivism in our correctional system, or even our high dropout rates, and we have high dropout rates in Alaska. We are not going to change those things until we look at the fact that we have a big number of kids in our state are prenatally exposed to alcohol whose brains work differently and need different strategies. If we attack those problems from that core, we'll have different outcomes.